Hi, I'm Dr. Michael L. Johnson. I'm a board-certified chiropractic neurologist. I've been in practice in Appleton, Wisconsin since 1983. I'm the author of this book, What Do You Do When the Medications Don't Work? A Non-Drug Treatment of Dizziness, Migraine Headaches, Fibromyalgia, and Other Chronic Conditions. I also consult with over 1,000 chiropractors across the country. And you can go to our website, lifechangingcare.com. That's www.lifechangingcare.com, all one word. And you can read some testimonials. So I'm here today to talk to you about insomnia, something that I know of personally, because I suffered with it. And I'm going to tell you how we corrected it. Now, what makes us different from any other doctor you've seen? We treat you metabolically and neurologically, and that's the key in treating insomnia. Metabolic and neurologic. We don't leave any stone unturned. And you're watching this because you or someone you love suffers with insomnia. Well, here's the thing. By using specific metabolic and neurological treatments, we can help you. What do? Well, we do specific blood panels, and I know you probably had blood work done and it's normal. Keep in mind, there are lab ranges which are extremely broad, and there are optimal or functional ranges which are a lot narrower. For instance, with your thyroid, your TSH, and thyroid controls all body metabolism, and you want to check it if you have insomnia. You want a complete thyroid panel. You just don't want to run the TSH, but normal TSH levels, lab values are 0.5 to 5.0. And optimal is 1.8 to 3.0. Big difference. So you want a thyroid panel. What do I mean? TSH, free T3, free T4, total T4. You want a complete metabolic panel, not a basic, a complete metabolic panel. You want a lipid panel, and you want a CBC, complete blood chemistry with auto-diff. Auto-differential means that you're looking at the white blood cells. You're breaking them all down. And you want to check it, you want to be thorough, because if you suffer with insomnia, you need to have your thyroid looked at, your adrenal glands. Your adrenal glands are your stress glands. I will guarantee you your adrenal glands are probably shot if you're suffering from insomnia. A lot of people with post-traumatic stress disorder, insomniacs. Why? Their adrenal glands have been exhausted. Cortisol production is shot. We'll get into this next. Liver, kidneys, red and white blood cells, all internal functions need to be checked because they could be causing your insomnia. Another thing is sensitivity testing. We want to check and see if you're sensitive to gluten, milk, soy, eggs, and yeast. If you're sensitive to any or all of those, it could be causing your insomnia. Here are some of the symptoms of these sensitivities: chronic pain or fatigue, frequent indigestion, bloated after eating, frequent loose bowel movements, constipation, mouth ulcers. You see, this is measured in 0 to 10 units. That's the measurement they use. I had a patient one time, she said she had mouth ulcers. She was at 400 units. She was off the chart. You want to look at an adrenal stress index. Remember I said if you have insomnia, your adrenals are probably exhausted. So you want to check cortisol levels. It's a salivary test, like a DNA test, and it's measured at 8 a.m., 4 p.m., 8 a.m., noon, 4 p.m., and 10 p.m. And it should be at its highest level at 8 a.m. and then gradually slope downward. My guess, if you're suffering with insomnia, it's flat or below. It's probably severely exhausted. You want to look at immune panels. Your condition, insomnia, could be caused by an autoimmune condition. Your immune system is attacking a part of your body. There's two parts to your immune system, Th1 and Th2. Th1 is measured with markers. So is Th2, by the way. But the markers are blood tests, and it's TNF-alpha and interleukin-2. If those are high, you're Th1 dominant. And then Th2 is measured by interleukin-4 and interleukin-10. If those markers are high, you're Th2 dominant. Th1 is T cells. T cells are the army that attacks and cleans up afterward. Helper T cells, suppressor T cells, natural killer cell activity, regulatory T cells, and macrophages. Th2 is B cells. B cells make antibodies. B cells tell the T cells what to attack. Now, if you're Th1 or Th2 dominant, you want to find out the cause of the dominance. What I'm saying is if you suffer with insomnia, you want to be as thorough as possible. So, what do? You want to determine what the cause is, either an active antigen, something the T cell to attack, or dysregulation. Is it a problem with anemia, blood sugar, adrenals? So an active antigen are parasites, bacteria, viruses, mold, yeast, fungi, protozoan, foods, chemicals, and heavy metals. That's an active antigen. You determine that by testing the food sensitivity or a stool microbial test. The best indicator for an active antigen is the helper-suppressor T-cell ratio, also called the CD4-CD8 ratio. If it's 2.5 or above, you have an active antigen. If it's 1.2 or below, guess what? It's dysregulation. So you want to find out the cause of the problem. H. pylori, we can test you for that. H. pylori is a bacteria in the gut. That could be the cause. Leaky gut syndrome. Leaky gut syndrome describes a condition of altered or damaged bowel lining caused by antibiotics, toxins, poor diet, parasites, or infection. That could be causing the active antigen. We may want to look at your neurotransmitters. We may want to look at your hormone levels. That could be causing insomnia. But let me tell you, if you're autoimmune, that trumps hormone levels. That trumps everything. You're not going to get better unless you address the autoimmune condition. We're going to look at inflammation. We want to look at your C-reactive protein and your homocysteine levels. Then, if we find these problems, we're going to treat you nutritionally. And we're going to use something called glutathione. Glutathione is the master antioxidant. It is the mother lode of antioxidants. Now, that's the metabolic side. Let's talk about the neurological side. There's 3 parts to your brainstem: top, middle, and lower. Mesencephalon, pons, and medulla. Normally, brain fires down to the lower part of the brainstem. And that slows down the upper brainstem. Well, when you have insomnia, you've lost that loop. See, cerebellum fires to brain, fires to lower brainstem, slows down upper brainstem. You don't have that happening. And the upper brainstem overfires. And what happens is a lot of times people with insomnia, they'll wake up like somebody hits a switch at 2 or 3 in the morning, or they have trouble falling asleep, or both. And that's that upper brainstem. It's overfiring. You want to slow that down. A lot of times those people with an overfiring upper brainstem, they've lost that loop, they'll have night sweats. I mean, their sheets will just be soaked. That's the upper brainstem driving down the spinal cord, called the intermediate lateral cell nucleus. Big fancy term. But that's what's causing the people to perspire. So we want to treat you neurologically. One of the things we do is exercise with oxygen therapy. Exercise with oxygen therapy. It's one of the best things you can do to increase firing to brain, to increase firing to lower brainstem, to slow down that upper brainstem. We either use an upper body ergometer or we use an elliptical machine while the patient's on oxygen. We're going to use brain-based therapies: olfactory stim, smelling different smells; auditory stim, increased firing of brain. Listening to sound in your right ear fires the left brain. Left brain controls right side of the body. Right brain controls left side of the body. You've all heard that. So if we put sound in your right ear, we're going to mainly affect the left brain. We may do visual stim. We may use something called an interactive metronome. It's visual, auditory, and motor stimulation. You're clapping to a sound. Sounds easy, but it's in milliseconds. We may use laser therapy. The bottom line is we want to increase firing to brain, to increase firing to lower brainstem, to slow down the upper brainstem. So you treat the patient metabolically, you treat the patient neurologically. That's how we get rid of insomnia. That's how we cure people of insomnia, not by taking a drug. There are side effects to drugs, and if you're taking a medication, fine, take it. I can't tell you legally to stop taking medication, and I never would. It's called practicing medicine without a license. So ask yourself the following questions. How has your insomnia affected your job, relationship, finances, family, activities? What does it cost you in time, money, happiness, and sleep? Where do you picture yourself in the next 1 to 5 years if your insomnia is not taken care of? Finally, what